In last month's February issue of the Journal of American Dental Association, an evidence-based article made recommendations for radiation safety in dentistry based on updated evidence. For the record, essentially the last time ADA made such recommendations was 2012. But the new review summarized some recommendations and also provided some guidance during digital radiography and cone beam imaging in order to reduce radiation exposure to our patients. A systematic review of database of 95 different articles and some guidance documents went on to recommend prudent use of radiographic imaging, which is no surprise, since, who else can argue with prudent use of anything in healthcare, right? It just might as well be on the safe side. But they went on to invoke the ALARA principle and recommended digital imaging instead of film imaging. However, they basically stopped short of recommending the use of a lead shield or a lead apron for this kind of imaging if you're using some of the modern X-ray machines. And can you believe that? Yes, the modern highly columnated X-ray tubes are shooting basically a laser beam of X-ray, and there's really no need to protect areas outside of the circle of scatter and bounce, which are really negligible in these particular types of devices. So not even the prudent and highly abundance of caution ADA is now recommending the use of lead apron. And you may ask, well, why? Well, that's part of the reason is because the thyroid collar may block the imaging, give you a cone clot, and you have to take another X-ray again. And also by changing the lead apron between patients, that increases the chances of cross-contamination, especially when it's not needed. So what do you guys think? Are you going to continue to use the lead apron? Well, I personally think that I will probably still continue to use it because it takes really longer to explain to patients why they don't need it than just putting it on and taking the X-ray. And people tend to be freaked out anyway when it comes to radiography. I use a lead apron, a light lead apron actually anyway, because it kind of acts as a weighted blanket to most patients and they kind of like it and they're comfortable with it. And also it allows me, by putting a lead apron on throughout the procedure, to leave some of my suction tubings and so on for some negative pressure and other light items on the patient's chest without them feeling me putting it on and taking it off. So it's really a practical solution for me as well as a patient comfort situation. Anyway, I just wanted to share this little bit of news that I thought was interesting with you guys, and I'd like to hear from you in the comments. What do you guys think? Are you going to just chuck your X-ray apron or lead apron, or are you going to continue to use it? So let me know in the comments, and I'll see you in the next video.